in November of 2015, I was doing some hobby welding at home, and I wasn't wearing the proper shirt. And in the course of that welding, that shirt caught fire. I woke up in the burn center of Maricopa Health Center, now Valleywise. I spent 5 weeks in the intensive care unit of Valleywise Health in the burn center. And over the course of that 5 weeks, I received exceptional care. I was in that hospital with probably the best health insurance you can get through SRP, my employer. Valleywise was going to get paid every dime that they spent on my care. But I knew that there were people in that burn center that didn't have that kind of insurance, that were going to be unable to pay for the care that they received. But I'm here to tell you that that care was exactly the same. The compassion, the passion, the understanding, the commitment was exactly the same for those patients as it was for me. And that wouldn't be possible without the support of donors, without the support of the foundation through its donors. So I came out of that experience feeling an obligation to give back to that institution that in many ways had literally saved my life.
I was born into a tumultuous family environment. I was homeless until I was 8 years old. We lived in oleander bushes and on park benches, and we eventually moved to homeless shelters when the opportunities presented themselves. My mother was drug addicted and the victim of domestic violence, and my father was a career criminal who I had only met several times across the glass in prison. I eventually was fortunate to go into foster care at the age of 8, and I was taken into care until I was 21 years old. I'm 31 now, so only 10 years ago did I exit foster care. My entire childhood, I remained poor, safe but poor, and I became astutely aware throughout my entire life that there were people who received different quality of care, health care, financial assistance, opportunities for education, depending on where you lived, how much money you made, what you looked like. And I became obsessed with the idea that I could change my own outcome. He was introduced to me as an individual who I might want to know, who might guide me in a path towards success. I had no idea what it would look like for me to become a doctor, nor did I have that interest then. To be honest, I had never seen someone who looked like me go into medicine. As I graduated from residency, I sought out my opportunities to practice internal medicine, which is the field of my specialty. I knew that I wanted to serve a community that I was familiar with and give back in a way that felt meaningful. And in considering my options, I decided to join District Medical Group so that I could care for the community here in Phoenix at Valleywise Health. A mentor is more than someone who gives you advice. A mentor is someone who invests in you, who sponsors you. Marion often says, and I believe, you are not a mentor until you have had your mentee over your house. Now, I know in COVID-19 times that's challenging, but I would urge you and implore you as mentors to seek out meaningful relationships with your mentees.
It's great that we are able to facilitate this program to put mentors and mentees together. I hope and know that it will be a beneficial experience for both the mentees and the mentors, and I'm so glad that we can facilitate it. I hope over the course of your mentorship, you come to a couple of things. Understand the vital role that Valleywise serves in our community, and that you feel some gratification in being affiliated with that organization and help it thrive.
So I challenge you, once you have not only been a mentee, but you become a mentor, reach back. That's the whole purpose of this cycle, is to reach back and lift up others so that they too can aspire for success.